So before starting, I did some general listening. It's a VM technique, and it indicated there was some issue left lumbar area, leaning over to the left and close to the spine. I know the client has some sacroiliac issues, so I'll probably be doing some of that as well. All right, so let's have a look. All right, so let me just look to see if there's anything asymmetric. Muscles are slightly larger in this area. It's very slight. If anything, it's pulling me closer to the spine. So possibilities: spine, muscles either side, psoas is underneath here, ureter underneath here. All right, so I'll just do some, I'm just feeling. By pushing towards an area that's tight, I take the stress, the strain off it, the tugging, and it can relax. And then once it's relaxed, it's easier to go the opposite way and release it. And I often work with my eyes closed. It gives me a better feel. So I can feel slight movement. All right. The next technique is called Recoil, and I would do it on the front as well later. So for Recoil, you have to load the organ. So I'm assuming that this is like the kidney at this point. And you load it by getting it to move as far as possible. Well, right now the kidney's falling away from me. and the kidney will be highest up when the client breathes out. So I'm going to push and hold it there, and then on one of the times when she's fully exhaled, I'll take my hand off quick. And what Recoil does is gently wakes up that area of the body. And then over the next days, week, it makes adjustments as it becomes aware. It's kind of like Thai massage. You're helping the body to wake up to something. One more time. Okay. All right. Let's do some sacroiliac. So let's have a think here. Just see if there's any issues first. How's that feel in there?
Fine.
Fine, okay. Not the piriformis, okay. How about in there?
More tender again?
What's that?
A little more tender?
A little bit more tender, okay. All right. So the piriformis attaches to the sacrum, and so if it's tight, it's going to try to tug it out of position. That's because when we stand on the ground, that is solid, and everything has to adjust to that. So normally I'd be on the opposite side and I'd be using the leg as a lever to help stretch it. So check the other muscles attached to the sacrum. How's that feel in there?
Fine.
Fine, okay, right. And here?
Tender.
Tender, ah, okay. So already we can see the situation set up to twist the sacrum. We've got tightness on the right side, lower right side, and tightness on the upper left side. So that's going to make the sacrum twist. That's not going to be good. It's going to lead to some discomfort. So it's gluteus maximus. do some deeper work here. Okay, another muscle is the coccygeus. So I'll test for that first. So tailbone, bone that sit on, in between. How's that feel in there?
Fine.
Fine, right. Tailbone, sit on, there. How's that feel in there?
Tender.
Tender. Right, so again, right side lower, pulling on it. And for this one, all you do is just lean on it gently. The sacrotuberous ligament crosses this area, so it'd be worth checking that. All right. I was just waiting for it to release. Right. So the sacrum sits closer into the body, so I can't lift it. So I'm going to push gently down on that to help release it, and then I'm going to grab the side and try to glide it. There's a diagonal in there. So just leaning on that, grab the side and pull down. You can add a slight downward pull with the hand on the sacrum, because the lumbar sacral area can become a little bit congested, and so pushing upwards might make it uncomfortable. There's another thing you can do, keeping pressure on the sacrum. You reach under to grab the front of the pelvis and you pull back. So grab the sheets, reach underneath. There we are. Right. And just pull up. None of these techniques are fast. You don't just pull and release. You have to let the body, or give the body time to respond, to see that it's safe for the fascia to let go. And you know it's working when you feel slight motion. And the longer you maintain it, the deeper the effect. Okay, now I'll try and do it the opposite side without getting my back to you. All right, so push down, grab, and pull. Because of the junction is this way, if I can push up while pulling down, that works, but difficult. But the bone that you sit on, you can just catch that one and then push up a bit without being inappropriate. Again, I'll do the sweep underneath here. Grab the sheets. There we are. Okay, and just to finish off, going for that notch, iliac crest, L4, L5, notch in there, because the sacrum's right in there, this tends to get tight. So sustain compression. And it's always good to do a stretch on the area. So I'm going to be heading out to camera range, but what I'm doing is gently pulling on the ankle, which will pull on the leg, which will open up this joint. And you can feel by how the legs move which ones releases easier. Right ones move in quite nicely, so I'll do one more on the left. Okay, I'm just checking the ankles, same height. Okay. So that was working on the sacroiliac joint. You loosen up the surrounding muscles, and then you get to slide and glide it afterwards. Thank you. All right.